Right, thank you very much for coming back on time. That's great to see so many. So before I introduce our next guest, I'd like to ask you a question. Think back to when you were initially diagnosed, and how many, just put your hand up to answer, how many of you were given well-meaning dietary advice by friends and family? It's me. I had a very well-meaning mother. Very, very well-meaning. So, how many of you received dietary advice from your oncologist or team? 1, 2, 3. Ooh, that's not very many, seeing as there's 140 of us in the room. So, I think there's a real need for our next speaker. So I'd like to introduce you to Francesca, who is a dietitian who is based at Oxford, and she's going to come and talk to us and dispel some of maybe those myths that we've got around cancer and what we can and can't eat. So with no further ado, I'd like to welcome Francesca.
Thank you very much. I'm Francesca. I'm a dietitian and I work in Oxford. Thank you very much for having me today. So what I'll try and do is summarize the scientific evidence we have on nutrition for ALK mutation. Before I start, just a disclaimer. I know we're very different ages, very different stages in life. We have different backgrounds. We have different goals. So you might be gluten-free, you might be vegan. So some of the things I might say might not apply to you, might not be relevant for you. That's fine. What I'll try and do is just show you some evidence, but not tell you what's right and what's wrong for you. What we all have in common is that we can use nutrition as a tool to just make our health a bit better, make us feel a bit better, and just a way of looking after ourselves and try and stay as strong, as fit as possible. So that's what I think we all have in common and that we can do. So I'm going to start with the myths, because they're everywhere. On the internet, we all have, as Deborah said, that relative or that friend that is going to give advice. These are some of the questions I hear a lot. Some are on specific diets, and some are very specific on foods, like what about turmeric? What about curcumin? What about very, very specific things? So I picked 3 of them, and hopefully through these 3, you'll be able to get the answers to also other questions or other things. So I'm going to start with alkaline diet. So alkaline diet is basically avoiding acidic foods. Now, what do we actually know about that? So we don't really have a consensus about what that means. So if you go on with different websites, it's going to give you different lists of food. So that's the first thing that it's not very clear. But what's more important is that the blood needs to stay at a certain pH or within a healthy range. And we want it to stay within a healthy range. So there's no health benefit in going more acidic or more alkaline. And the body knows that, and all of the system will try and keep us within the healthy ranges. So the lung will work for that, the kidneys will work for that, all of the system will try and keep us within a healthy range. So it's true that the cancer cells cannot survive in an alkaline environment, but also healthy cells cannot survive in an alkaline environment. And finally, about this diet, we didn't have a lot of literature at all. So I couldn't find anything on ALK plus mutation. I could find one study on EGFR mutation. I decided to put it there anyway, because I think it's a good example. So this study says that patients following this type of diet had a little bit less side effects reported by them. So what are the problems with this study? So first of all, it was done on 5 or 6 patients, so not enough to actually run some statistics. And secondly, in all of the article, this diet is not described. So we don't know what they were actually eating, how often they were actually eating it. And also the other group, we don't know what the other group was doing as well. So we know, so it's not really good evidence. So it's always important to check how much literature you have on how many patients it was done and how good is the evidence and how is this a quality study. Is this something that we can trust? So let's move on to sugar. This is very, very popular. So actually it's quite similar to alkaline diet. So there is a certain levels of sugars that we have in the blood, and we want to keep that within a healthy range. We don't want it to go too high or too low. And again, the body will try and keep that healthy level of sugar in the blood. So if we cut out sugar completely, we don't have any sugar at all, the body will still break down fats, protein. It will take it will use whatever it can to still keep that level of sugar in the blood. So cutting out things completely doesn't mean that you're necessarily going to starve the cell, because you're still going to have that level of sugar. Also, sugars are found in some very healthy foods. They are naturally in milk, they're naturally in fresh fruit, so you don't necessarily want to cut out all of those things. And by that, I'm not encouraging you to have a lot of sugar, because we know it is linked to obesity, it is linked to increased level of inflammation, it is linked to some chronic diseases like diabetes. So obviously I'm not encouraging you to have loads, but at the same time, cutting out completely might not starve the cancer. It might have other health benefits, but not starving the cancer specifically. So reason why you should have it is because I would recommend still including fruit or other things that have a little bit of sugar in your diet. And also we need to consider quality of life. So sharing a piece of cake at a birthday party or with friends, that's what makes life nice as well. So we need to consider that. But also we know that excessive amounts or a high intake, that's generally linked to chronic diseases or higher inflammation or weaker immune system. So definitely, if you think you have a sweet tooth and you're having like every day a few treats, then maybe yes, consider cutting out a bit. Next one, this is very specific for lung cancer. So I think the beetroot thing all started from a case report, so a single patient in China who after 5 years came back. So he was diagnosed with lung cancer. 5 years after, came back to the same hospital where he was diagnosed, and he didn't have lung cancer anymore, but he did have a stomach cancer. And what they found is that he had been having 2 liters a day of beetroot juice. So the question was like, maybe that got rid of the cancer, but as you can see, it's not a really strong evidence. That being said, beetroots are really healthy. They're rich in fiber, they're rich in antioxidants, definitely include them in the diet, but they're not necessarily gonna fight the cancer. And this is, I want to use beetroot as an example of other things. So there's also green tea, turmeric, curcumin, lemon. You might have heard various different things. So most of these things have actually been tested in cancer cells in a laboratory, and a lot of them have been shown to have really beneficial effects. So some of them actually slow the cancer growth, some of them stop the cancer growth, some even might kill the cancer cells. However, we don't have any answers on humans or even animals. Many of them have not even been tested on animals. So even if it's really promising, what we need to understand is how much and how often and how should we take these things. For example, is it beetroot juice? How much? Let's say 2 liters a day. How much of that is going to be absorbed, and how much of the part that it's going to be absorbed is actually going to the cancer, and maybe not to the liver like alcohol, and the part that goes into the cancer, is it actually going to have the same effect that it has in a lab? So there are all these bits that are missing, which is why at the moment there's no beetroot or no food that we know that is actually going to have that effect in humans. So how do we distinguish? So always check the source. Most recommended are journals, charities, healthcare professionals. Look at the evidence, look at the study. Is it a study with many patients? Is it a study that's relevant for you? Is it a good quality study? Is there anything being sold at all? That's usually a red flag. And also very restrictive diets. Again, so there's no evidence that by cutting out whole categories of foods there is going to be a health benefit. So if it's a very restrictive diet, always be a bit careful, because they need to be sustainable in the long term. Here are some websites that talk about some of the myths, especially the British Dietetics Association goes quite into a lot of details. They have quite a lot of resources. So if you're interested in specific myths or things, that's a really good one. And also wanted to quickly show the pyramid of evidence. So you see at the bottom, there is animal studies, laboratory studies, single patient studies, and experts' opinions. They're all good at the base. They point us in a direction, but then we need many more layers, many more studies. And what you usually get from clinicians and healthcare professionals are the things that are just at the top. So they were quite sure and quite confident that that's going to make a difference. Otherwise, we don't usually recommend something. So conclusions, there's no superfood or a specific diet that's going to directly fight ALK plus mutation or starve. There are some preliminary studies on cells, but none of that is good enough at the moment to recommend anything. So that might seem like bad news, but we know a lot of other things, and there's a lot of other things that we know that we can actually do and that we know that works. So first of all, I'm going to start, many of you might be aware of this, malnutrition is always a risk if you have cancer and if you're having treatment. So malnutrition can be even just losing, 5% of weight, so not much, in a very short period of time. You can still have these side effects. So we're not necessarily worried about the weight loss itself. It's more of the unseen consequences. So reduced muscle function, high risk of falls, lower mood, lower quality of life, lower energy. If you get an admission, you might be admitted for a longer period of time than someone who has a good nutrition. If you injure yourself or if you have a wound, it might take longer for you to heal from that. So there is a lot. So that's why usually as healthcare professional, we're always a bit worried if you're losing weight or if your weight is not within a normal range. And that can happen in ALK plus as well. So these are the main risks. So shortness of breath might mean that you're eating a bit less. You might feel fatigued. Anxiety, especially linked to the diagnosis, you might eat less because of that. Bowel issues, you might have diarrhea because of the targeted treatment. So usually these are risk factors. So what can we do to prevent it? Check your weight, check how much you're eating. If recently you have reduced the amount you're eating, is there a reason? Are you doing that on purpose? And are you having any symptoms that are affecting how much you're eating? It doesn't necessarily have to be cancer related. You might need to, a tooth extraction or something. You might be eating less because of that. But that's something to be careful with. And if you have any of those three, always communicate to your team, let them know, especially about symptoms, because they can help you manage them better maybe. Talk to your family, because and find strategies together. So if you feel too tired to cook, is it okay to discuss with your family? Is it okay to rely a little bit more on ready-made meals? Can they help you with cooking? If you're becoming very sensitive to smells, is it okay for them to leave the windows open? So try and discuss these type of things that can help you. You can always ask a referral for the dietitian. I think most cancer centers will have a dietitian. If you don't think there's one in your center, or if you don't have access to them for some reason, it's been only a couple of months, so the World Cancer Research Fund has opened a helpline on Tuesdays and Wednesdays. So you can call directly, it's free, and you'll directly talk to a dietitian. So if you think you're struggling to have access to that. So if you think you're losing weight and if you're worried about becoming malnourished, what we recommend is you following a high energy, high protein diet. So changing the pattern of the things you're eating to try and increase the calories you're getting in. So the three most important things are protein, possibly every meals, multiple times during the day. If you're vegetarian or vegan, just rely on cheese, eggs, pulses, or alternatives, that's absolutely fine. But try and have them well distributed during the day and possibly every meal, or have it as a high protein snack if you're not having it in a meal. Fortification, so be a bit more generous with oil, sauces, all the things that won't change the volume of a meal, but will just make it a bit richer in calories. What you can see in the picture is someone adding powdered milk to milk, so that it gets, extra rich meal. You can have the same amount, but it's same thing as drinking more. And then rely on smaller snacky meals. It's okay not to have your normal plate with your traditional roast. It's okay to have snacky things multiple times during the day. It's more important to be consistent than to have a traditional looking meal. And finally, and I care about this a lot, you can still be overweight, you can even be obese and malnourished. So the fact that your BMI is very high doesn't mean that you cannot get malnourished. So even if you lose a bit of weight in a small amount of time, you can have still all of the consequences of malnutrition. So again, ask for help, discuss with your family. Now, you might have the opposite problem. So you might be having a course of steroids and becoming really hungry, or there are other medications as well that makes you really hungry. Or it might be that you're overweight and you just want to lose a little bit of weight. So in that case, especially if you're on medication, I think it's really difficult to discuss, and we all know about this. You know, have smaller portions, have less sweets. I really don't like talking about the things that you shouldn't be having, because we all know that. So I think it's important to focus on the things that you can have and that are not making the situation worse. So definitely fruit and vegetables daily, possibly every meal. That's because things that are rich in fiber will make you feel fuller for a longer period of time. So hopefully you can wait between one meal and the other without feeling too hungry. Switch to all brown things, all wholemeal things for the same reason, because it's higher in fiber. So switch to brown pasta, brown rice, brown bread. Again, you get more fiber, and possibly associate it to a protein. It has been seen that a protein plus a fiber-rich meal is the thing that's gonna make you feel full for the longest time. So hopefully if you focus on that, you can have 3 meals a day, even big meals, but you won't get as many calories as snacking throughout the day. And then planning is really important. So it's really difficult. Usually starving yourself if you're hungry doesn't help, because you're just gonna have a bigger meal after. So plan. If you know you're getting hungry middle of the night or after dinner, make sure you have something that it's reasonable that you can have. So for example, a fruit salad and some homemade popcorns, and you have a handful of fruit salad, a handful of popcorns, a handful of fruit salad, and you go on like this, and it's still going to be less calories than if you get a couple of trifles from the fridge or something like that, and you still get a bit of crunchiness, a bit of variety. So it's planning things that are, that you can have, are going to give you a little bit of satisfaction without you getting lots of calories. Alcohol has a lot of hidden calories, so obviously if you can reduce the consumption, do it. And obviously being physically active helps. Now, the other thing that we know is that targeted treatment can give you diarrhea. Now, if it's really bad, obviously do rely on the medications, but there are things that you can do if you're having a period in which the diarrhea is a bit worse. There are things you can avoid. So caffeine usually makes it worse, so it helps the contractions of the intestine, and we really don't want that when we have diarrhea. So coffee, strong tea, fizzy drinks, some supplements, they're all high in caffeine, so try and have caffeine-free drinks. The size of the meal as well, usually the bigger the meal, the quicker the food is pushed down. So again, we want to reduce the size of what we're having, or maybe just eating it a little bit slower. So again, we don't move things too fast. Greasy, hot, fried food can make it a bit worse sometimes, and also high fiber foods. So what you can do is cook your vegetable a bit more than usual, or take the skin off your fruit. So just try and reduce for a period of time until the symptoms are better, to not make it worse. Sometimes there are temporary intolerances, for example, a temporary lactose intolerance you can have, and keeping a food diary for that kind of thing usually helps you identify a pattern. And you probably know this, but I'm still going to say it. You lose a lot of fluids and minerals, so make sure you always replace your fluids and check that your urine is always like light yellow, clear, so that means that you're still getting a good hydration. Now, we mentioned be physically active, and that was a little bit vague. So what does be physically active mean? So the recommended hours, it's 2.5 hours a week of moderate activity or 75 minutes a week of intense activity. Intense activity means being, like not being able to talk to the person next to you. That's intense. If you're working, try and have breaks. Try and go and get a glass of water, go to the toilet, have a bit of a stretch. Don't stay too many hours just being sedentary. If you are not doing any physical activity at all, just start with a 10 minutes walk and build it from there. That's absolutely fine. You're still going to see a benefit from that. If you're worried about other healthcare conditions, for example, you have pain, shoulders, definitely ask for a referral to a physiotherapist or discuss it with your medical team, because they might be able to identify some exercises or some activities that you can do, and you just focus on those. And so, yeah, these are the recommendations. When we talk about just be active, this is what we mean. The other thing that can happen is taste changes. So what has been proven to work is increased mouth care. So do mouthwash a bit more, floss a bit more, brush sometimes even before the meal to get rid of the nasty flavor, and also after. Candies might help. Trying new flavors, new spices, sticking to the flavors that you know you like and using that type of spice or sauce everywhere, that can help. We know that hot temperatures enhance the flavor. So if you're struggling to eat, to taste anything at all, maybe go for a hot meal. If you're tasting too much and it's unpleasant, then go for room temperature. Also, the taste buds regenerate every 8 to 12 weeks. So always try, if you don't like something, still try it after a few weeks because it might have totally changed. So what we know for sure is that it's important to prevent malnutrition, that with a good nutrition, we can achieve a better immune system, reduce the inflammation, keep our strength, keep our muscles. So there are a lot of things that we can do with nutrition, and that yeah, it can work. And it's okay to change your pattern if you need to, build up or lose weight for a period of time. That's okay. To be a little bit more healthy or a bit less healthy, okay, it's also okay. And we're going to see the last one. So what is nutritious choices and balanced meal? What does that mean? And we're going to see it now. So the World Cancer Research Fund came up with some really good guidelines on how to maintain long-term health with nutrition, prevent chronic diseases, which we all want to do, prevent risk of cancer. Now, actually, these are the same guidelines if you already have cancer. So they're still valid. This is still, the World Cancer Research Fund used a lot of evidence. So this is really strong scientific evidence that this is the best way of eating. So fruit and vegetables daily, healthy fats, herbs and spices, beans and legumes weekly. Try and stay within a healthy weight, and that for you might mean that you're a little bit overweight or a little bit underweight. That's still okay. Limit red meat and processed meat, limit alcohol, and be physically active. So we've seen be physically active, we've seen what that means. What does balanced meal means? So they should look as much as possible as the Eat Well plate. So possibly every meal, a fruit or vegetable, a source of carbohydrates, a source of protein. So that's the ideal. Now, which ones to choose? So the best thing is to rotate. So have as many different fruits and vegetables as possible, have different sources of protein. In terms of carbohydrates, you can do 1 day quinoa, 1 day rice, 1 day brown pasta, 1 day buckwheat. So the best thing is to vary as much as possible. Then what does reduce red meat and processed meat mean? and also alcohol, I forgot to put it there, but it's the same thing as red meat. So the health benefit doesn't come from a specific amount of meat or a specific amount of alcohol, it comes from the reduction. So if you're having red meat every day, going maybe 3 days a week, that will have a health benefit. If you're drinking 8 pints on a Saturday night, maybe alternating a pint and an alcohol-free drink, a pint and an alcohol-free drink, that will give you an improvement. So always compare yourself to yourself and see what you can change. Don't compare yourselves to others, because the reduction is what helps, not really a certain specific amount. And yeah, we said to rotate whole grains, fruit and vegetables, just do as much variety as you can. Supplements, so the multivitamins are not recommended in ALK Plus unless you have a deficiency and it's been shown through your bloods. So generally we don't recommend to have multivitamins. Vitamin D deficiency are very common, but I think we all get tested, especially if you're during treatment. I think every few months you need to get tested, so they will tell you if you're deficient in that. It can happen that you might have a potassium deficiency or a magnesium deficiency. It happens. So the best way to prevent it or to help is following the Eat Well Plate, the guidelines, all the recommendations. So that's the best way. But sometimes if you're having diarrhea, if you're having treatment, the losses are so high that even if you're having that really good nutrition, you're not managing to maintain that level. And at that point, it's really fine to have a supplement or an infusion. That's fine, it will help. So there are no specific supplements for ALK Plus in general that are recommended, no evidence yet at all. But there is some evidence on other conditions. So for example, if you have arthritis, you might see a benefit in having an omega-3 supplement. So always consider your health overall. Don't take things specifically for cancer, because there's no evidence at the moment. And the bottles you see in the pictures are build-up drinks. They can be used by your oncologist or your dietitian if you're trying to build up, or if you're worried about your weight loss, or if you want to stop the weight loss. They can be really, really helpful. So again, discuss them with your team. So the conclusion is that there is a really strong evidence on what type of diet is good to prevent chronic condition, to maintain your muscle, to keep a good immune system, to reduce inflammation. So there's really, really good evidence for that. If you're malnourished, what's recommended, it's a little bit different. So high energy, high protein, which is not exactly the same as the guidelines, but that's much more important that you're not malnourished anymore, rather than having a super healthy diet. Always consider the scientific evidence and your health overall, because you might have other conditions, not just the ALK mutation. And yeah, always talk to your team if you're worried about it. I'm going to leave these websites here, and if you have any questions, let me know. Thank you. Do we get a microphone? How do I go about it?
Yes, thank you so much for all that information. I have a few questions, if I may. You mentioned about red meat reducing it.
Yeah.
Conversely, if you don't eat red meat, do you actually advise?
That's a really good question. I should have said it. If you're not having red meat and if you're not having alcohol, keep not having red meat and not having alcohol, definitely.
And also you said one of the side effects with the diarrhea is loss of minerals. I think you kind of mentioned, how do we replace the minerals apart from the food? Is there something to, I mean, it's not just water. Is there anything we can add, or what is that?
Water, if you're having really, like just a couple of days of really bad diarrhea, something like Lucozade or rehydrating powders, they can be helpful. Generally, fruit and vegetables, whole grains, they're all quite rich in minerals. So generally they will help. But if you're having really good, big losses, even if you have a lot of bananas, it's not gonna replenish the potassium.
What are your thoughts on having smoothies, green smoothies?
Oh yeah, I think that's absolutely fine. Yeah.
I
yeah.
think, sorry, if I'm asking too many questions, please
No,
say.
no, no, I think smoothies are fine. You do break down, when you blend fruits or vegetables, you do break down the fiber. So that can be good if you're having a bit of diarrhea or something, because you're having a bit less fiber. It can be bad if you're a bit constipated, or if you want to get the whole benefit of the whole fiber, that may break down a little bit. So depending on what your goal is, but yeah, the smoothies are fine.
Can I continue?
Yeah.
And what are your thoughts on things, supplements such as, high omega, like chia seeds, hemp seeds, spirulina? Is there any side, if you're on the TKIs, is there any contraindication in taking those in your smoothies?
So it depends which one. I think things like flax seeds, I think that they're fine because it's just seeds and nuts, and I think that they're absolutely fine. They are gut, for example, they are beneficial for your gut health or that kind of thing. So don't take them thinking about the cancer. Take them thinking about your health in general. Some of them, I'm not sure about spirulina, but some of them might interact with the medication. So if you're not quite sure, ask to talk to a pharmacist and check if they're interacting with anything. But generally, especially if it's chia seeds or flax seeds or things that are food anyways, they're usually absolutely fine and actually quite good for variety.
Two more. Herbal teas such as nettle tea and dandelion, things like that. Again, is there any interaction or any contraindications of having those things?
No, not herbal teas. Not herbal teas unless they're fortified with something specifically. Herbal teas should be absolutely fine.
And finally, your thoughts on, you hear about organic, non-organic. What do you think? Is there really a difference?
Not at the moment, not particularly. So sometimes they are a better quality, but at the same time, organic means that they're not using any chemicals at all. So sometimes things grow like molds or other things, and they can be damaging. So it's not like 100% guarantee that the product is better. It has different risks. Yeah, maybe you get a bit less chemicals, but you might get a really nasty mold or something. I mean, that's up to, I think that would be up to the person. If you know the source, usually that's always better, because there are some really, really nice.
Last one,
yeah.
I promise. If you're not losing weight and everything's fine and you're on the treatment, again, what are your thoughts on this whole idea of intermittent fasting?
Okay. So there is some, not on ALK Plus, definitely no evidence on ALK Plus. They are starting to do some studies on fasting, especially, but that's more linked to chemotherapy, especially, before and after chemotherapy. And there is some preliminary evidence at the moment that you get a little bit less side effects from the chemotherapy if you're fasting, but we don't have a lot of answers for it. So for example, how many hours should you fast? We don't actually know. Does it work differently for different people? Possibly. So we have very few studies with very few patients. So possibly, but at the moment I wouldn't do it. I've talked to people who are doing intermittent fasting, and they're finding that it works for them. So, I mean, I think everyone, you should manage your day as it. Definitely do not fast if you're diabetic, or also don't fast for a long period of time if you live alone, I think, because you can always have, a sugar drop or something. So at the moment, I wouldn't recommend it in general. There's no points proven that it's going to have some actual benefit. So, no problem.
You mentioned diarrhea, but you didn't. But if you've got the opposite problem of actually constipation, what foods would you recommend?
Yeah. So definitely all of the opposite. You want a little bit of caffeine, you want a lot of fiber, dried fruit is quite good, lots of water, so the water will hydrate you, but will also hydrate the stools, which will make it softer and easier to pass. So definitely movements, even a gentle massage if you don't want to do some sports or something, or you can't. Even a gentle massage, some movement helps. Some people find that probiotics helps, but doesn't work for everyone. So maybe something to try. And then there are some gentle laxatives like psyllium. That's quite natural. It's quite light. So definitely, if food only and fiber only is not working, I would try something gentle.
I just wanted to ask about the actual drug, because when I took the drug, I put on an awful lot of weight, 18 kilograms, and it seemed to increase my appetite. And I spoke to my oncologist about it, and they said it was water retention. And then I didn't want to take another drug on top to deal with the water retention. So I'm just wondering if there's anything that you can have. I was told dandelion tea was a good thing to have. I tried that, it didn't really work. But to counteract the increased appetite, I mean, I've taken away some tips that you've already said with regards to having your 3 meals essentially and the type of things that you're eating. But also as well, the water retention is a huge problem for me.
Yeah. So there are, herbal teas, these type of things can help a little bit, but I think compared to water tablets, they do very, very little. And there's no really a replacement or something. Like if you have edema and it's quite bad, then I would definitely take the tablets. And for appetite in general, I think that's the best thing to try and do. Balanced meal and prepare the snacks, and fill them with things that are going to create a volume, but are not going to give you as much calories as other things. So that's.
And you mentioned turmeric, and you also mentioned about speaking to your pharmacist about contraindications, and that's really important with regards to the contraindications, because it can have a contraindications with the drugs, can't it?
So if you just sparkle a little bit on food, generally no. If you have the supplements, that's really concentrated, that's a really high dose that could interact with something. So if you're taking very concentrated things or pills or tablets, definitely check with the pharmacist. Even if it's a natural thing, check with the pharmacist. But if you're sprinkling things on top of it, that's not enough to.
So my question has just sort of been supplanted by that, because I prescribe for lorlatinib, which I suspect is what's causing the problem. So when we have a drug that causes both weight gain and peripheral edema, as a doctor, is very difficult. So the steroids and the lorlatinib, and some patients are on both. Is there any good way? I don't think the water tablets work, quite frankly, in that situation either. Is there any good way we can tell, serial waist measurements, or, because body weight isn't particularly helpful in that situation, is it?
No, it's not. There is the bioimpedancemetry. I don't know if you use it. It's 10 minutes. You put 2 electrolytes on the feet and on the hand, and you can see how much is muscle, how much is fat, and how much is water. And you get a really good measure of how much edema there is. But it's not very used, I think.
If our very simple stats that we have and evidence we have to be believed, then probably a little over 40% of the patients in the room here are on one specific medication called alectinib, which requires an amount of fat to be taken with it to ensure absorption. So I think the guidance is somewhere between 15 and 20 milligrams of fat when you take the medication, which has to be taken twice a day. Now, with a meal, a decent breakfast and a decent evening meal, that's fine, but people lead busy lives, and sometimes it's not always appropriate, or they've forgotten, or something. So what would you suggest as something just quick and easy to take with medication, where you need that amount of fat quickly, just to make sure that you're absorbing the medication
Yeah,
properly.
yeah, yeah. So bag of nuts, if you're not allergic, can be any type of nuts, almond, walnuts, anything. You take like just a handful, that's enough fats. Or boxes of cheeses like a Baby Bell, that probably has enough fats, so that's something that you can have as well. Maybe dips, but those are a bit more difficult to carry around. So I would definitely go with small nuts or cheeses or seeds as well. They do the boxes of seeds as well. They are quite oily, so they will have just a small handful will have enough fat, definitely. Maybe a yogurt, yeah, I think a yogurt, full fat yogurt will probably have enough. And small things that you can find around, like, you know, mini, I don't know, sausage rolls or mini, like small snacks that you find. Sometimes even biscuits, if they're quite buttery, will have enough fat.
Sorry, I've just got another question. You've talked about dairy, and a lot of people gave me advice about cutting dairy out because of it being inflammatory. Is that something that you suggest to people? Is it in moderation?
Not particularly, unless you're intolerant or if you want to be vegan. I think dairies are like part of a healthy diet. If you're having in moderation 1 portion a day, they will not increase inflammation. So it's maybe having too much or maybe having them, I don't know if you're intolerant, but no, yeah.
Yes, the mucus forming they were talking about.
Oh, for that, okay. That's really a bit controversial because there are some studies but there are also studies that say that they don't make any difference at all. So I think that's more individual. So when I talk to someone and milks give them a lot of mucus, maybe yes, I would recommend not having it. But the evidence is very little. So it's more on your personal experience, unfortunately, because the evidence is still very vague about that. And it's a really...
You mentioned vitamin D tests, and I don't think I get vitamin D tests. I think there's a little murmur round about me as well about getting them. Should I be getting a vitamin D test, and what is a vitamin D test?
It's just, when they draw your blood normally, sometimes they check your vitamin D, sometimes not. I think most centers will check them every 6 months, and they just don't tell you anything if the level is good, usually. That's how it happens. If you think you're not being tested, then maybe, yes, mention it to your oncologist. You don't need to get a special one. Just when you do your routine ones, they will just add vitamin D. They don't need to take more bloods. They don't need to do anything different. It just gets added. And maybe, yes, I would say, at least once a year, if you're not checked, maybe check it.
Aside from a sort of alcohol in moderation, can you change or improve your diet to look after your liver a bit better?
I think, the recommendations are exactly the same. So the liver is quite good at detoxifying on its own. So you don't need particularly like any specific food, just good hydration. That's really good for the liver. But also varied, balanced diet. That's the best thing to keep your liver healthy rather than doing very specific things.
Just a general question. Will we be able to get the slides, your slides?
Yeah, sure, yeah. Okay, great.
So I think everyone would agree that we've all learnt something this morning. One, maybe that we could no longer justify those fry-ups in the morning because we actually only need a Baby Bell. bad news, isn't it? There we are. I think the second take-home message for me was we should check with our pharmacists. If any of us are taking any supplements, we should check with the pharmacist. We do not want to be taking our targeted treatments and then find that something that we were additionally taking, supposedly to help us, is actually having a detrimental effect with our treatments. So I think the advice has to be check with your pharmacist. And I think the last take-home message for me was, and I like your optimism, reduce alcohol in moderation. I didn't see that on the slides. I saw no alcohol. So maybe you need to borrow my glasses. That's what I saw. Anyway, can we all thank Francesca a great deal for coming along today?